Hi, this presentation is about abortion and the facts and arguments between each side, for or against abortion. First off, abortion is the deliberate termination of a human pregnancy, so that is the mother of the unborn fetus deliberately getting rid of the child. Every state has their own laws about abortion because it is a state issue rather than a national issue, but in most states, the average law is that the baby can be aborted before it reaches 24 to 26 weeks. Here is a chart of late-term abortions in the U.S. So if the state is shaded gray, then there's no limit to up to how long a child can be inside the womb before it can be aborted. So in these states, it is legal to abort the child all the way up to birth. If it's a yellow state, then after 18 to 20 weeks, then the baby's abortion is blocked by the courts. If it's orange, there's a limit after 20 weeks. So after 20 weeks, you can't abort the baby. And if it is red, then there's a limit between 18 to 20 weeks in those states. So that just gives you an idea of all the different depending abortion rules in each state. And you can find your state and see what your state currently has for their rules. Facts about abortion are that there are nearly 1.1 million abortions in the United States every single year. 1 in 4 pregnancies ends in abortion, and 51% of abortions are performed on women 25 years old or less. So that means just over half of all abortions performed are on women who are less than 20 or equal to 20. So that's a very good chunk of the abortions performed. Now here is the more graphic side of it. These are the methods used in the United States for abortion. The first is dilation and curettage, and this can be used when the baby has been in the body for up to 12 weeks. So after 12 weeks it cannot be used, but up until then it can be. In order to get the baby out during this method, the uterus is dilated, so it's expanded, and then the baby's body is removed in pieces, which are removed using suction and a curette. The next form is dilation and evacuation, and this is used up to 18 weeks. Forceps are used to remove the baby from the uterus, and body parts are individually extracted. There is a hysterectomy, which is used in the last 3 months of pregnancy, so this is a very late-term method. And in order to do this, an incision is cut into the mother's uterus and the umbilical cord is cut. As a result of this, the baby then suffocates inside the uterus and is then extracted. For intracortical injection, this can be used at 4 months after the baby has been conceived, so about halfway through the term. A little less than halfway through the term. A chemical is injected into the fetus's heart, which causes its immediate death. The body is then absorbed by the mother since it is so early on. Here are the methods continued. There is something called a prostaglandin, and this is used during the second half of the pregnancy, so anywhere from 4.5 months up. A hormone-like compound is put into the uterus using a needle, which causes contractions to be induced. The fetus is then pushed out, but as it is pushed out, since the contractions are so violent, it is unfortunately crushed to death. There's the RU486, and this is used during the 7th week of pregnancy. A steroid blocks a hormone that the fetus needs, and then the second drug is used to cause the contractions, which gets the fetus out of the body after it has been killed by the steroid blocking the hormone. There is a saline injection, which can be used between months 4 and 7, which is a salt solution which is injected into the abdomen. The fetus then soaks up the salt, and the salt dehydrates the fetus and it dies of this dehydration. The dead or potentially still alive and dying baby is then delivered after the salt solution has occurred. Then the last method is the suction abortion, which is the most common method in the first 12 weeks of pregnancy. So this is the one that most women who are getting abortions use. And this is where a current with suction is inserted in the uterus and simply sucks the fetus out. There are some risks that go along with having an abortion, and here's a list of all of the main risks. There could be heavy bleeding, infection, depression, sepsis, scarring, cervix damage, internal organ damage, eating disorder, guilt, flashbacks, substance abuse, endometritis, and death. And a lot of people don't know, but going along with an abortion, there can definitely be physical risks, but there are also emotional risks, which can cause the depression, the flashbacks, the guilt, and sometimes even PTSD in certain cases. Now here are some arguments for why people believe that abortion should be legal, and one of the main ones is that it should be a woman's right to do what she wants with her body, and if she doesn't want to have a baby with that body, a woman should not have to have a baby because somebody else wants her to or the government wants her to. If abortions were to be banned, then women would potentially be put at risk for at-home abortion attempts. What that means is they would potentially attempt abortion without a nurse, without a doctor, without a hospital and sterilized tools. They would try and do it at home, which could definitely lead to a lot of accidents and deaths. There are a lot of women who are young and aren't ready for a baby, and they don't have another option because their family can't afford a child, or they are trying to get their education when the child occurs. Many people believe that personhood begins after the fetus is viable. So what that means is many people believe that a baby within somebody is not a person until they get out of the womb and take their first breath and until they're given their God-given rights. So many people believe that an onboard fetus is not considered a child. Another argument that is a big one is that fetuses can't feel pain prior to the 26-week mark. And science has pretty much proven this, so many people feel like as long as you do it before 26 weeks, the fetus cannot feel that abortion and they cannot be pained by it. So it's okay. And then the last reason, which is a sensitive one, is that allows women to, when going to get their ultrasound, if they see and their doctor tells them their baby could potentially have abnormalities, which would include mental illnesses, physical disabilities, things that could potentially lead in a short, harmful, or unnormal life for the fetus, the mother and father then have that option to abort the baby before it is born to prevent pain for the child if it would die soon anyways, and to potentially just prevent it from occurring even if pain would not ensue. Now, the arguments against abortion are mainly religious and ethical beliefs, so many people find it against their religion or against their personal ethics to have an abortion, because many people also consider abortion to be murder and consider the killing of the child no different than killing a baby who was born. Consider it the same. These people believe that life begins at conception, so as soon as the mother and father conceive the baby and the sperm and the egg meet, the life of the baby begins. So they believe that the fetus is alive and that they should protect it. Their other main argument is that fetuses over 26 weeks can often feel pain during the abortion. So as we already talked about, fetuses under can't, but fetuses over can. So they believe if abortions over that 26 weeks period are wrong, because then the baby can feel the pain as they are being taken out and extracted. And then the last argument against it is that it can potentially cause psychological harm to the mother, because as we talked about, it's a very hard decision and it could potentially result in depression and PTSD, etc. Rather than getting an abortion, there are things you can do to prevent getting pregnant before. You can have abstinence, which is not having sex at all and not engaging in any intercourse, which would make it impossible to have a kid. Or if you do choose to take that step, but you don't want a child, you use various birth control methods to prevent having that baby at the point before, rather than taking care of it after it's too late. And then lastly, here are some alternatives to abortion. There's parenting the child, which is the most obvious one. You could keep the child and then become the parent. There's adoption, so you could give the child up for adoption rather than giving it up completely. And then there's also temporary foster care or guardianship. So the child could live with somebody else while the parent was getting their life together, and then they could go and be the child and have their actual parent be their guardian eventually. So that was all about abortion and the facts about it and the different arguments between it.